Hi everyone, this is Dr. Shal again, and today we have a special guest from Australia, Mr. Sam, and he's here for his hair restoration and complete transformation. Let's ask this from Mr. Sam himself, how he got to know about us and what brought him here.
Thank you, Dr. Gupta. An absolute pleasure to be here. I'm so glad that at long last, I was able to make it all the way through from Sydney to your oasis. This I just want to start with with the infrastructure and with the setting that doctor has. Yes, he's a surgeon. He's got to have all those the medical equipment and so forth. But I in particular want to speak about the vibe. The moment you enter the premises, you can feel that this doctor is distinct. He's unique in his own ways, and some of those being, the touch of, nature, the touch of empathy, the touch of, all these other good interior, the calming vibes and everything. So that sort of, puts your mind and your nerves at a lot of ease. So that's my instant gut feeling and my observation. Now coming back to when I initiated my journey to go for the overall, not only just hair transplant, but to get a bit of a stuff done for my visible lines, my wrinkles and all and what have you. So I did a lot of homework. I looked around to a lot of resources, did so much of comparisons, being a analytical guy myself, I did a lot of, digging around. There are places available. I spoke to many people within India itself, in Chandigarh, in Delhi, and so on and so forth. But Dr. Gupta is distinct. Is quite unique because that level of empathy and sympathy, and which sort of goes a long way to put the patient's mind at ease. I think he's not only think, I'm quite certain that he's solely dedicated to the profession, and the testament of this is the plethora of videos and resources that he's compiled and put on the YouTube and other channels. So when you go through these channels and you watch all those videos, you can straight away tell that this guy, mate, his fair income, he's totally he's totally committed. He's not just your average other doctor around the block. So that reassures, provides you a lot of a feeling of reassurance. He is quite competent. The feedback is amazing, and to talk to him was an absolute pleasure. And I'm sure we'll have much more conversations in the next couple of years, Doctor.
You have left me speechless.
No, thank you. That was just my observations. Yeah.
Thank you so much. Yeah, and in fact, indeed, hair restoration is easily one of the most important decisions of your life, and there is so much of stuff available on internet and so much of information which can at times be confusing, and it's a big decision. I understand the emotions behind it. I have myself done a transplant. I had a very small recession of hairline, not that big, and but even that small transplant has changed the way I look at myself, and it is good. And whatever I have achieved in my life, it is not just work or whatever work anyone is doing. It is not just related to earning money, or it should help you to evolve as a person. And this hair transplant thing has really helped me to evolve as a person. Every single day we are doing repeatedly the same thing. It can be boring at times, but no, it is not. And every next surgery, I mean, the subsequent surgery which we try to do, we do it better than the one which we did previous one yesterday. And it is such a, and I'm lucky that I have, you mentioned it, I'm really lucky to have a team which believes in my principles and ethics, and they put their 100% effort in achieving what we are doing, and it's really immensely pleasurable. And I consider myself so lucky that I'm into this profession, where not only we can help you to transform physically, but yes, the mental aspects, mental transformation. Even if I don't give you any tip, just by having your hair back, you get it on track.
Yeah.
and then happiness and everything is there, which can take it the long way. The momentum is there now, so carrying this forward into other things, I think all of us are busy for 40 45 50 years of age, not really thinking much about ourselves. And when you start thinking about yourself, maybe this could just be the first step in this journey of self love.
Yeah, look, I'll say that pretty much you already have an encyclopedia of every single thing I mean, that is required for the end-to-end process. But obviously, coming here, seeing you and your staff, and and your setup in person, that was a huge relief, and that sort of reinforced everything that was depicted in these videos and so forth. Um, Staff again goes out of the way. And like I said to you, whether it's a doctor or a businessman or anybody, they can be only as good as their staff. So you're quite fortunate in the right selection of the right people. That's a good thing. I did have quite a few other questions as well because I couldn't ask those questions being busy myself, and obviously you are so busy as well. But the staff did clarify, your subject matter experts, such as your doctors, they did clarify many of those questions. So I feel quite content. I feel quite satisfied and quite happy. And I know, like you keep saying, that it's a teamwork and it's a journey. It's not a one-stop, or it's not a one-off thing. Um, One thing I want to say is that after I saw you, and you suggested a couple of other things, that could potentially enhance my appearance and my confidence. That was kind of like a moment for me to self reflect and think that, oh God, I've been just working and doing other chores for so many years, and I never spent my time to look at myself. So, and one of the quotations that you have, that you got to love yourself as well. So thank you so much for the ambience, for the support, and for everything else. And I'm pretty sure that this is just the beginning, not the end.
Yes. So, as hair transplant is a journey, life is also a journey, and we should not really worry about the destination. It is the journey which is more important, and the pleasure is in journey itself, and that's how life goes. So, really happy to have you here, and tomorrow we are going to operate you. It would be a 2 day surgery. Then we are doing a combination of FUT and FUE. So, how excited are you about it? Now, you have been waiting for this, I guess, for almost an year or so.
Look, I've been waiting for it for a long time, around 10 years or more. But just that, having young children, having work commitments, and I just never had a chance to think about or to prioritize this, But enough was enough, and one day I said, no. And when I found you and the right, being the right person, but making a decision just became much more quicker for me and easier for me. So I'm looking forward. Doctor, one thing that I think we should clarify for our audience is that I spoke to a couple of other doctors, and they're heavily against FUT. I mean, straight off the bat, I realized that FUE is easy, and FUT, because requires much more resources. You need a team of technicians to dice and slice the tissue. So there's a lot of negative hatred, and what people are trying to do is, other doctors, they're saying, oh, it's an old school, it's this, a lot of hair go wasted, there are some hair in the dormant phase or something when you slice. So I think, if you don't mind, I would like you to spend a couple of minutes to
Yeah.
talk about FUT, because I think, and in all honesty, this is another big center that has branches back in Australia as well. Um, their commitment, they were offering to go for 5,000 grafts just by FUE. And if I had not used my instincts and my brain, I would have fallen a prey to that. You're gonna butcher my entire donor area, and what am I gonna do later? I mean, I'm one of those lucky ones who has quite a dense, dense donor side. But then it is my donor. I mean, it is priceless for me.
Exactly.
So please, if you don't mind,
Yes.
let's throw some light on this negativity of FUT,
Yeah.
and why, and especially why are other surgeons criticizing this approach?
Okay, see, when I started my journey 20 years back, there was only FUT. And FUT, I was just now, I was remembering those days when we started doing it, it was tough, really tough. And still I'm learning. 20 years down the line, still I'm learning. But yes, it is a difficult art to learn. You got to have those surgical skills. Looking at the commercial aspect, suppose I need a team of around 8 to 10 trained technicians who are doing FUT. Now if I train them for FUE, I can split them into 4 or 5 teams and get done 4 or 5 FUE surgeries in a single day. So that is again difficult. Now FUT, surgeon has to get involved, so I'll be taking out the strip and
Yeah.
everything. Now if FUE is there, then I can ask my technicians to take the grafts out. And so FUT is more skillful surgery, needs more investment in terms of time, human resources, as well as the equipments. So FUT is not an outdated technique, it is rather uh, the most advanced technique. In fact, FUE was earlier also in picture when the punch size was slightly bigger.
Yeah.
So they used to do punch grafting. Then this FUT, follicular unit transplant, came into picture. Then the punch size got reduced, and we know this by FUE. Now people are selling FUE by different names also.
Yeah.
They are, someone calls it direct implant,
DHI and all that. Yeah.
DHIT, imperfect, perfect, so many names, but it is all the same thing. Now, most important here is you have almost 70,000 hair which are present in the bald area. Now, 30%, 30,000 hair are present in the donor area in this portion. When I am doing FUE, I create gaps because I can choose one out of three. One out of three. When I am doing FUT, I cut the strip because of good elasticity of skin. Sometimes we are able to cut the strip 3 times. I mean, subsequently, three surgeries. That means FUT gives me access to such a big area where one surgery, second surgery, and third surgery, I can take all of them out, and still you have the remaining donor area absolutely untouched. That means no reduction in density at all if I don't do FUE, just 3 FUTs. While on the other hand, what will happen, I cannot take all of them out through FUE, otherwise it will create this big gap. Secondly, if I do one FUE and I try to do repeat it from the same donor zone, the biggest problem there is the graft, because of fibrosis, the exit angle remains same, but the inside, the angle of hair root changes because of fibrosis. It gets pulled, and we don't know which side it will get pulled. So you put the punch. FUE is a blind procedure, we cannot see. Second, FUT is shear waste. I mean, in most of the cases, the graft transaction is highly unacceptable. Second, FUE. So these are the reasons why FUT is not in demand these days. People who were actually doing FUT, because of ease, comfort, and commercial reasons, they have stopped doing it. And most of the doctors these days are not trained to do FUT at all. FUT is a difficult surgery. Not everyone can do this. I am still learning, but yes, this is the fact. Secondly, we cannot do justice to the donor of patient. Complete justice can never be done, because now this guy, we come across patients where FUE has been done once or twice, and the donor is gone. It looks very bad. Now the patient cannot even wear a patch because it doesn't match. And these patients, still we can perform FUT, and thousands of such cases I have operated where we managed somehow, because patient had hair in this portion. Now there are gaps or islands of hair, and he is very desperate to get it filled, but he cannot do. Now another excuse, or maybe pro thing which they tell, we have through FUE we can take out grafts from beard or chest hair. Or see, even I can do that. I am doing it. So but what about the scalp hair? Are you making full use of scalp hair? No, they are not making full use of scalp hair. Another important thing, this is a message, since he has asked, people always remember that this transplantation is a journey. And in this journey, if you have cut FUT or maybe the medicine completely, probably you are not the right candidate to take this journey forward. You stop at this point, because only FUE technique will desert you soon, and you won't be having any other option left. So those guys who have already done one FUE, please don't repeat the mistake now. I mean, it wasn't a mistake probably, but second FUE is obviously a mistake. Now, what happens here? many of the time, and I have exposed this so many times. Do you know the medicine finasteride? It is a magical medicine. It grows back here in some to such extent. Sometimes it looks even better than a transplant. And what finasteride can feel, I cannot feel as a surgeon. I can never feel as a surgeon. When you see cases of grade 6 or grade 7 who are completely full, समझो दाल में काला है, बल्कि मैं बोलूँगा दाल ही काली है. As a combined surgeon, FUT and FUE, I have never been able to fill grade 7 completely without help of high doses of finasteride. By high doses, I am telling you 1 mg per day. Though it is FDA approved dosage 1 mg per day, but we have seen that people respond to very small doses, 1.5 mg or 2 mg per week, and they do, I mean, they do respond pretty well. So you don't really need to bring stronger medicines in the ecosystem of patient. And eventually it is your health. You are not just paying in terms of money. You pay through your donor, you pay through your health, and you pay through long term sustenance of your hair. You put that also at stake. So this is very important. These three resources, and again important thing, in fact, it's a very common practice where patients get a transplant done and they are asked to do 4, 5, 6 PRP sessions subsequently.
Yeah.
In fact, few days back I was consulting a patient. He was from Sydney, a Bangladeshi guy, got his transplant in Australia itself, probably direct hair implant, and then he was taking 6, 7 sessions of PRP, and it was all butchered. So he wanted to come for a repair thing. So these subsequent multiple sessions of PRP, they actually don't help. So whatever benefit you get from the very first session, then it is totally useless practice to inject again and again. I have done my transplant almost 26 months back, and only 2 PRP sessions since then. So medicine, your donor, and this PRP, these three resources are important in this journey, and it is your responsibility to ensure that you get maximum out of it. And always remember, less is more. When when the surgeon is promising you something which is he is not able to deliver on his own, he'll be bound or forced to use those manipulating medicines, and then you will have, it will create a gap between expectations and reality, and this is going to hit you hard later on. But by the time you might realize it, maybe it is too late. And sometimes I've seen patients who don't even realize this, that they have been tricked.
Yeah.
Because they think that it's a wonderful transplant as long as they are taking the medicine, it's all good. And as soon as they stop, they start noticing big gaps and everything. So FUT is a very, very important surgery, and I'm not biased for FUT. We are doing FUE also in your case.
Yeah.
So these are two reliable, two important weapons in hand of a hair transplant surgeon, and they are really important, and we have to use it combined, maybe one after other or simultaneously depending upon the case. Now, one gold standard thing what I am seeing there is, I mean, not gold standard, uh, most of the surgeons have same plan for every patient.
Yeah.
4 to 5,000 grafts,
Yep.
same FUE method, and same 1 mg finasteride per day. Some of them will tell you, oh, you take it for 6 months, 12 months, and then maybe you can stop or reduce. Some will tell you have to take it for lifelong. It's like a blood pressure tablet, just keep taking it. They never talk about tolerance, which is again a very, very neglected and important part of this strategy. So, hair restoration is a wonderful technique. It can really transform your life, provided it is you and your doctor who are using technology, not you getting tricked by the technology. So always remember this, keep this in mind. Thank you. Thank you so much. And Sam, so tomorrow we'll see you in the OT, and we'll do the stuff. Take care.
100%, Doctor. Thank you so much.
Thank
See you
you.
tomorrow morning.